This is critical thinking in the reproductive system, and here are the questions. Here you have to find the incorrect statement. This is something about vasectomy, and here you have to find the true statement. So let's look at this first one, which asks you to find the incorrect statement, and the statements are: the first one is the tunica vaginalis helps to lubricate the testes. So this is a true statement because the tunica vaginalis is a remnant of the peritoneal cavity, and just like the peritoneal cavity helps to lubricate the organs in the abdomen and pelvis, here the tunica vaginalis does help to lubricate the testes. The second statement, which tells you the correct pathway for sperms, is the seminiferous tubules, then the epididymis, then the vas deferens, from where it goes to the ejaculatory duct and the prostatic urethra. This is also true. And just to show you this, let us look at this image here. So here you can see this is the testes, which is divided into lobules, and inside each lobule you have these seminiferous tubules where the sperms are formed. From here they pass through the efferent ductules into the epididymis. So this here is the epididymis, where they are stored and they mature. They travel down from the epididymis, go all the way into the vas deferens, and then the vas deferens travels into the abdomen. And if we look at the next image here, we are looking at the vas deferens once it has entered the pelvic cavity. So here in the pelvic cavity, so the sperms have traveled in the vas deferens. This vas deferens meets the seminal vesicle to form the ejaculatory duct. So the next is the ejaculatory duct. So it next passes into the ejaculatory duct, which will then pass through the prostate gland and open into the urethra. So another image to show you that is here, and you can see the ejaculatory duct opening into the prostatic urethra. So therefore this second statement is true. Let's look at the third statement, which says the Dhatus muscle helps to contract the testes during sexual activity. This is false because the Dhatus muscle contracts. It's not the testes which contracts. The muscle contracts, and it is important for thermoregulation. What the Dhatus muscle does is through its contraction or relaxation, it either decreases or increases the surface area available for either to conserve heat or for heat loss. So that's the function of the Dhatus muscle. So this is the incorrect statement, and hence the answer here. But let's look at the next one, which says secondary oocytes are released into the peritoneal cavity. Now this is a true statement, and again let us look at an image. And this image here shows you the female reproductive system. And so here's the ovary, and when there's a bulge on the surface of the ovary, and that which is formed by the secondary oocyte, when it ruptures, it is thrown into the peritoneal cavity. So this area here is the peritoneal cavity. So all of this is the peritoneal cavity. So once it's thrown out into the peritoneal cavity, it gets sucked in by the fallopian tube and then passes into the uterus. So therefore the last statement is also true, and the incorrect statement is this one, and hence the answer to this question. So let us look at the second question, which says what would be the result of performing a vasectomy. The first statement, which says the volume of seminal fluid would decrease drastically. Now this is not true. This would not be a result of performing a vasectomy, because the volume of seminal fluid, about 90 to 95%, is through the prostate gland and the seminal vesicle. When you perform a vasectomy, all you do is prevent sperms from getting into the seminal fluid. So therefore only about 5 to 10% would be missing, which is formed by sperms. So the volume would not be decreased drastically. The second statement, which says this person would become impotent, this is also not true, because impotency is the inability to either attain or maintain an erection, and which is to do with the nervous system and the blood supply in the penile corpora cavernosa and spongiosum. The vasectomy does not interfere with that at all, so this is also not true. The third statement, which says no sperms or testosterone would be produced, again is not true. Sperms would still be produced. It's just that they are interrupted. So if this is the testes, semen, and the epididymis, and here is the vas deferens, and you ligate it here, sperms still get formed. They are produced. They pass up, and they cannot go further. So what happens is they just die in this area. So they would still be produced. They just cannot go up. Testosterone is a function of the Leydig cells, which are still okay and able to produce testosterone. So this would also not be affected. And let's look at the fourth statement, which says the volume of seminal fluid would not be drastically affected, which is the exact opposite of this. And this is the result. This would be a result of performing a vasectomy. The volume would not be affected. The only thing that would happen is that sperms would not be present in the seminal fluid. So that part of the statement is not included, but this is correct, that the volume would not be drastically affected, because you only take away 5 or 10% of the seminal fluid when you perform a vasectomy. So sperms will not be present in the seminal fluid, and hence fertilization will not be possible. And let's look at the last statement, which says the internal urinary sphincter will not close when seminal fluid enters the prostatic urethra. This again is not going to happen as a result of a vasectomy, because when the seminal fluid will still enter the prostatic urethra through the ejaculatory duct, and the internal urinary sphincter will close, because that is a function of the sympathetic nervous system. The moment seminal fluid enters the prostatic urethra, the sympathetic nervous system closes this internal urinary sphincter so that no urine passes out along with the seminal fluid. So this would not happen as a result of vasectomy. So the answer to the question is the fourth statement. And let us look at the last question, which asks you to identify the true statements. So let's look at these. The first one is a rectal examination in males can help palpate stones in the prostatic urethra. Now this is not true, and again let us look at an image. And if we look at this image where this is the rectum, and a rectal examination where the finger is placed in the rectum, you will not be able to feel a stone in the prostatic urethra, which is up here. So if there's a stone in this area, you won't be able to feel it, because a prostate gland, which is very thick, is going to prevent you from feeling that. What you can feel is a stone present in the penile urethra at this point here, because the corpus, at this point, the bulb is absent right over here. So you may be able to feel a stone in the penile urethra, and the corpus spongiosum, which surrounds the penile urethra, does not have much cavernous tissue, so you can still feel it there. So therefore, that statement is not true. So hence, this statement is not true. Let's look at the next one, which says sperm count is higher in summer. This is again false, because sperm count is higher in winter. Sperms, in order for the testes to function normally, you need a lower body temperature. And in summer it is really hot, whereas in winter, when the temperature is much colder, helps the sperm count, the testes produce sperms, and so hence sperm count is higher in winter. In fact, in people who have a low sperm count, they're often told to wear boxers instead of briefs, because briefs are tight and they increase the temperature in the genital area. So that's why they're advised to wear boxers. So that's the reason why this statement is false. Let us look at this one, which says an anteverted anti-flex uterus will face the sacrum. This again is not true. And let us look at an image. So if you look at this image, this is showing you an anteverted and anti-flexed uterus, where the uterus is bending over the bladder. So it faces the pubic symphysis. A retroverted, retroflexed uterus will face the sacrum, because this is going to look this way. This will face the sacrum. So therefore, that statement is false. So here, this statement is also false. So these were statements which are false. So let's look at this fourth statement, which says uterine fibroids cause heavy menstrual bleeding as they can increase the surface area. Now this is a true statement, and to show you a picture, here is an image of uterine fibroids, especially those fibroids which are in the muscle and they pass into and they kind of block the uterine cavity. If you notice here, you can see they are going to increase the endometrial surface area. See this? They have increased it. If you look at this here too, they increase the endometrial surface area and therefore cause heavy menstruation. So hence this statement that uterine fibroids cause heavy menstrual bleeding as they increase the surface area, this is the true statement. And so these were false. And let's look at the last one, which says birth control pills act by preventing sperms from reaching the fallopian tubes. Now this is also false because they don't affect the sperms at all. What they do, birth control pills, is they affect ovulation, because they are usually contain both estrogen and progesterone, so they prevent ovulation. So when there is no ovulation, obviously there is no secondary oocyte to fertilize. And in fact, people on birth control pills have what are known as anovulatory cycles, and so they lack the secretory phase of menstruation. So therefore this statement is also false, and the true statement is this fourth one.